But then there is what the Health Summit said. But wananchi down are saying, it is not working for us. How do we marry that and say, and bring a conversation where wananchi are satisfied that what government is telling them is the truth?
True. You see, and to my brother Davji, I'm not saying that it's not entirely working. What I'm saying is that if I have a facility and I've not been paid for the past 3-4 months, then I might tell you that the system is down, because I don't want to take more credit. And that is what many facilities are doing. One of the private facilities that I take my family to used to tell us that they are no longer using SHA for some time. And I confirmed from SHA itself that they were actually accredited and they were supposed to be offering those services. And they were saying that because they had debt that had not been paid. So, you see, for us to be able to change a system, we must also look at it very objectively, and we do positive criticism. And I think we must keep saying that Parliament, because it's Parliament that budgets, Parliament that must ensure that we're having at least enough money, one, for the financing through SHA, and also we must reach a point where we have very deliberate efforts to have annual employment of health workers. We do not only have an issue with the effective management of health workers, but we also have a dire shortage that actually threatens the achievement of the UHC. But then there is a legal and policy ecosystem that is also prohibitive. And that is why we are saying, if we continue subjecting health workers to the current legal and policy framework, we may not be able to get somewhere. And to be clear, what I'm trying to say is, most of the counties are not even doing beyond 60% of the staffing norms and standards that is required at the minimum. But when you go to their wages, they will tell you that our wages are past the 35% ceiling as per the PFM Act. Some will tell you we are at 60%, yet on the other hand, they are telling you we don't have enough health workers. And so we must have a conversation, because then, if today, let's say the president was to say, Parliament, please allocate 10 billion to hire health workers, if that money goes into the equitable share, first it's going to be subjected to that formula. The moment it gets to that county, 30 must be for development, 70 must be for recurrent, and out of the 70 for recurrent, only 35 is for wages. So if you were to take that 10 billion, less than 3 billion will be available to actually hire that healthcare worker. And that is why we are saying, can we remove this human resource from this confusion of this prohibition of the legal framework, get a separate entity. And I think we are proposing either Health Service Commission or a joint authority under Article 189, so that if you give that authority or that entity 10 billion, the entire 10 billion is going to be available to